Hello everyone, welcome to the online class of Chinese medicine gerontology. Today we will study the contents of dementia. First, let's learn the definition of Alzheimer's disease and the understanding of Chinese and Western medicine. Dementia is an acquired intelligence impairment syndrome with cognitive impairment as the main symptom. It mainly occurs in the elderly, and its daily living ability or social occupational function is reduced or lacking. The scope of cognitive impairment includes memory or retention, understanding, judgment, calculating, language, visual space, and even accompanied by mental, behavioral, and personality abnormality. There are many causes of dementia, and the progression of the disease is chronic. The prevalence of dementia is about 5% among people over 65 years old, and as high as 20% among people over 80 years old. The prevalence of Alzheimer's disease dementia account for 16 to 17% of all types of dementia. Other major types are vascular dementia, Lewy body dementia, frontotemporal dementia, Parkinson's disease dementia, and so on. There are many risk factors for dementia, among which are more important. One is advanced age. The other is gender. Female AD patients over 65 years old are about 3 times as old as men of the same age. Male AD patients are more than female, which is related to male cerebral vascular disease. The morbidity rate is higher than that of women. Third, the history of head trauma. 4 is the apolipoprotein E allele. Fifth is the vascular risk factors, such as diabetes, hypertension, hyperlipidemia. Disease increases the risk of dementia. Sixth, education, occupation, and economy. In addition, lack of exercise, malnutrition, loneliness, and depression are also risk factors for dementia. What does Chinese medicine know about the etiology and pathogenesis of dementia? We will briefly discuss. Due to the elderly aging, lack of brain marrow, or due to the chronic illness and weakness, blood deficiency, or due to the improper diet, hyperfunction of spleen and stomach, and due to the poor mood, liver qi stagnation, stagnation of qi, and blood stasis. For some people, long-term illness and evil retention, spleen and kidney deficiency can lead to lack of midna, and eventually lead to the useless or clearing of weights caused by this disease. The disease is located in the heart and kidney and is related to liver and spleen. The basic pathogenesis is the lack of midma and the divine uselessness. Pathological factors are mainly flame, blood stasis, fire, and poison. Flame, blood stasis, fearing heat, poisoning, and other diseases stem in the stagnation of the brain, and the brain is inaccessible, leading to the useless of the magic machine. The pathological nature is based on the deficiency of the standard. The deficiency is the spleen and kidney. the deficiency of qi and blood, and phlegm and blood stasis, fire and poison, internal resistance in the brain, and the virtual and real often change each other. The kinetic evolution of the disease is divided into one period and the second period and decline period, and they often appear alternately. Deficiency syndrome is common in the platform period, and the general condition is stable. In the fluctuation period, there are common force and solid inclusions, and the heat and liver are prosperous, and flame and blood stasis are obstruct, resulting in mild to severe illness. The decline period is mainly due to factors such as sex, passion, and recurrent stroke, which aggravates cognitive impairment. At the same time, the syndrome changed from false to real, and the condition changed from fluctuation and worsening. Below, we will briefly talk about the clinic manifestations, evaluation, and diagnosis of dementia. The main clinic manifestations of the disease are decreased intelligence, abnormal mental behavior, and decreased ability of daily life. Different types of dementia have different characteristics. Screening of dementia requires the use of related skills, such as CDR, mini-cognitive, and MMSE. Clinic diagnosis of dementia can be divided into three steps. First is determine which dementia. This is evidence that there is short-term and long-term memory impairment. At least one of the following criteria: abstract thinking disorder, impairment of judgment, impairment of other advanced functions of context, such as aphasia, misrecognition, and so on, personality change. The first two obstacles affect work, daily social activities, and interpersonal relationships. Not any happens in dementia. It is related to specific organic factors. It cannot be explained by any non-organic mental illness. Then judge the severity of dementia. CDR 0 points is normal cognitive, 0.5 points suspicious dementia, 1 point is mild dementia, 2 points is moderate dementia, 3 points is severe dementia. GDS, first grade unrecognized. Cognitive decline, level 2, very slight cognitive decline, level 3, mild cognitive decline, level 4, moderate cognitive decline, level 5, severe cognitive decline, 6th grade, severe cognitive impairment, grade 7, very severe cognitive impairment, and finally we will determine the etiological type. According to the diagnosis process of dementia etiology, cortical or subcortical characteristics, the presence of multiple ischemic attacks characteristics, whether it is movement disorder, whether there is obvious emotional disorder, whether there is hydrocephalus. Finally, we will learn the syndrome differentiation and treatment of TCM for Alzheimer's disease. First of all, the principle of syndrome differentiation and treatment is to learn the key of force and real. The acute exacerbation period is based towards, and the stable period is based on the originals. If the acute exacerbation period is based towards the standard, the flame, blood stasis, and other factors should be used to resolve the flame, blood circulation, and blood stasis. The stable period is based on the original deficiency. The main use of the kidney and marrow spleen and turbid, waiting for the principle. Combined with kinetic experience, the common syndromes of dementia are four syndromes: deficiency of marrow C, syndrome of deficiency of both spleen and kidney, syndrome of flame, and syndrome of blood stasis. In the kinetic, it is necessary to distinguish the main symptoms and secondary symptoms, combined with tongue coating and pulse, and use the prescription medicinal. The main symptoms of dementia are sluggish expression, slow movements, and memory loss, and poor speech, combined with difference of secondary symptoms, such as if accompanied by childish behavior, crying and laughing, lazy thinking, quiet and silent, of accompanied by dizziness and hearing thinking teeth, sore wrist and knees, difficult walking, and other symptoms combined with tongue whims, thin tongue, pale color, thin white form, and thin weak pulse. So the diagnostic is the lack of evidence of the marrow thing. It is appropriate to add or subtract qi fu yin if accompanied by sore wrist and knees, muscle atrophy, less food consumption, lack of gas, laziness, or lab with nut wall, 五根 diarrhea, abdominal pain, and other symptoms. Combined tongue whim, pale tongue, fat tongue, and tooth marks, with firm, thin pulse, especially doubt feet. So the syndrome is deficiency of both spleen and kidney. We need to use 团少丹 in the kinetic. If accompanied by unthinking diet, mouth salivation, abdominal distension and pain, fullness and discomfort, heat weight, numerous vomiting and other symptoms, combined with tongue whim, pale tongue, mouth white growthy, slippery pulse. Syndrome differentiation is flame and flame syndrome. Treatment method should expel flame, strengthen spleen, and remove flame. If accompanied by skin nail arrows, dry mouth, and undesirable drinking, dumb and staring eyes and other symptoms combined with tongue whim, dark purple tongue, thin white firm fine pulse if it is late, the syndrome of blood stasis and obstruction of qi. In addition to TCM syndrome differentiation treatment, there are some comprehensive treatments, such as cholinesterase inhibitors, can be used to treat mild to moderate AD, and the other many times is used to treat severe AD, and there are also non-drug treatments, such as cognitive therapy, environmental therapy, music therapy, light therapy, aromatherapy, exercise therapy, which play a positive role in the treatment of AD. Above, we next briefly mention the prognosis of dementia. Currently, there are no special preventive drugs. Comprehensive measures such as effective control of vascular risk disease, such as hypertension, diabetes, and maintaining a healthy lifestyle and eating habits. Proper cognitive training and physical training can reduce the possibility of dementia. The prognosis of dementia depends on the course and the severity of disease. To achieve early detection, early diagnosis, and early treatment, extend life expectancy, and improve quality of life. In general, we mainly study the definition, risk factors, etiology, and pathogenesis, clinic diagnosis, and TCM and Western medicine treatment of AD. We hope that everyone will know after class. That's all for today's lesson. Thank you all.